The next class is the spirochetes, and spirochetes are having the axial filament and they are motile and give the corkscrew appearance. In the spirochetes, we have the three most important bacteria. First one is Borrelia, second one is Treponema pallidum, causing syphilis, and then the non-significant leptospirosis and also leptospirosis. So these three are discussed under the spirochetes. The first most important is the syphilis caused by Treponema pallidum. Treponema pallidum is a spirochete, and it causes syphilis, which is one of the sexually transmitted infection. And syphilis has different stages. First is the primary syphilis, and in this it is a localized stage of syphilis, in which there is only a painless genital ulcer known as the chancre, and this is localized only into only present on one part of the body. And after few days of primary syphilis, we have the tertiary syphilis, in which the bacteria get disseminated and causes and affect multiple tissues, including skin. In the skin, we have maculopapular rash, also known as maculopapular rash, and on the palms and soles. Then we have a most significant condylomata lata, which is a smooth, also painless, white colored wart like lesions. Also, there is a lymphadenopathy, and which is non-specific finding, and also a lymphadenopathy and patchy hair loss. The two most important disseminated symptoms are palms and sole maculopapular rash, and condylomata lata, wart like lesions. After secondary syphilis, the bacteria goes into the latent phase, and in this phase, serology is positive, but there is no symptoms. Then after years, the syphilis emerges into tertiary stage, and in this stage, if it affects heart, causing endocarditis, and it also in the tertiary syphilis, it forms the chronic granuloma stage, which is known as gamma formations, and this is because of the plasma infiltration. Then in the CVS system, it affects the aorta because it destroys vasa vasorum, lead to obliterative endothelitis aorta. It affects the aorta and destroy the vasa vasorum, damages leading to the formation of thoracic aortic aneurysm, aortic root dilatation, and aortic abnormalities, which leads to mediastinal whitening. And after affecting CVS, it goes into the CNS system, especially the dorsal column, posterior column, and forming tabes dorsalis or neurosyphilis. And in the neurosyphilis, we have the broad-based broad base gait because it affect the dorsal root column. So there is no sensor, there is a impaired coordination between the sensory and the motor pathways. The broad base gait, then we have the positive Romberg sign, in which the person in which there is a clue of in which there is a history in which the patient is in the morning he just closes his eye and on the shaving basin and having a fall like episode. So this is known as positive Romberg sign. And also there is a Argyll Robertson pupil, which is also known as prostitute pupil because it accommodates but not reactive. So these three are very important clues regarding the tertiary syphilis or late disseminated syphilis. So after this we have the Charcot joint and also Charcot joint goes to the joint and called Charcot joint, and also stroke without hypertension. But these are non-specific symptoms, not very much testable. So these three are the stages of Treponema pallidum. And how to diagnose a Treponema pallidum bacteria? First, we do a non-specific VDRL or RP. These are most sensitive tests, but not so specific because they diagnoses Treponema along with the Borrelia and also giving a false positive conditions, for example pregnancy, in leprosy, lupus, also in rheumatic fever, also the person using the drugs of chlorpromazine and also procainamide. So these also the Epstein-Barr virus and hepatitis virus. These all conditions give the positive test of VDRL. So that's why it is non-specific, non-treponemal test. So the most accurate or the direct or most specific test is the PCR and fluorescence Treponema antibodies microscopy. So the treatment of choice for Treponema pallidum is penicillin G because of the structural penicillin G is the D-ALA structure analogy with the bacterial cell wall. So if the person is using penicillin G, then after few weeks there can be reactivity, which is known as Jerix-Hashmeyer reaction, which is a flu-like condition. Flu-like, it means there is fever, chills, myalgia, and it appears post using post penicillin treatment, and it can also be appeared after other spirochete bacteria. Along with the syphilis, we discuss here the congenital syphilis. If the person is infected with syphilis and she get conceived, then there's a chances of and she is untreated or left untreated, then there is a chances of congenital or transplacental spread of the syphilis into the neonate. So there is so syphilis is one of the torch infection, and in the torch infection it can causes congenital syphilis, in which there is a facial face problems, there is a saber shin, and also deafness. So in the face we have the short maxilla, we have the Melbury molars, we have the saddle nose, and also snuffles and the linear scars from the angle of the mouth. And the specific finding for the facial abnormalities is the Hutchison teeth or notched teeth. So these are all the important information regarding the syphilis. Next, the bacteria. The next one is Borrelia. So Borrelia is transmitted via Yorkshire's deer tick, and this vector has a natural reservoir of mouse. So the tick bite or feed on the mouse, and then it can infect the deers, and from there it can also infect humans and causing Borrelia infection. And a mouse is the natural reservoir. Deer is used in the name, but deer is not included in the deer cannot harbor this bacteria, but it is used in the cycle. So edox tick can also cause anaplasma species, and also it can cause babesia pathogen. So the Borrelia is most endemic in the north eastern part of US and also north part of Europe, especially the woody or the forest, or especially in hunter population, and also the people which are dealing with the lot of deers. So Borrelia, like syphilis, Borrelia also causes infection in different stages. So the first stage 1 is very much localized, and in this it just causes flu like symptoms, and there is not always but commonly the common finding is erythema, migraines, which is a target like lesion at the site of insect bite. Then it leads to stage 2, which is early disseminated, and in early disseminated it affects the heart and causing endocarditis, also causing AV block, and in the CNS it causes bilateral Bell's palsy. Then there is a migratory myalgias, and also there is transient arthritis. After infecting heart and this CNS system, it, if left untreated, it complicated as encephalopathy, peripheral neuropathies, and also leads to this, or transient arthralgia is permanent and leads to chronic arthritis. So these three are the stages of Borrelia, also known as Lyme disease. Very much tested, and treatment of choice for Lyme disease is macrolides. Treatment of choice is, first of all, we give doxycycline first line, and then we give amoxicillin, and if disseminated affecting CNS or CVS, then we give intravenous ceftriaxone. So after Borrelia we have discussed syphilis, we have discussed Borrelia, and the next one is Borrelia is diagnosed on aniline dye or aniline agar growth media, gives a big Borrelia. Only Borrelia grows on aniline agar. So this is all about Borrelia and syphilis. Next one is leptospirosis, and that is very low yield, not very much tested. This is the spirochete section of gram negative bacteria.